on the boosters, the president got his booster a couple minutes ago. Are White House staffers getting boosters as well as the White House proper considered one of those high-risk settings like healthcare, grocery stores and the like?
Sure. Well, the CDC, as you all know, just released this information or these recommendations, this guidance on Friday, and so there hasn't been a determination made. But I will note, since you gave me the opportunity, it's pretty clear. This is one of the reasons the president conveyed this as well, exactly what this means. People who are 65 years and older, they can look at their vaccine cards. If it's been more than 6 months and they had the Pfizer shot, they should go get another shot. Long-term care residents and staff, people who are 18 years and older who have underlying medical conditions, including asthma, diabetes, obesity, there are others, and those who work and live in high-risk settings, including healthcare workers, teachers, grocery store workers who had the Pfizer shot. Just look at your vaccine card. If it's been more than 6 months, you should go get a shot.
Who's going to make that determination about the White House complex? Is that a CDC decision? Is that a White House medical office, medical unit decision?
We follow CDC guidelines, but given the guidelines just came out on Friday, we're still making a determination about how it would be applied.
Just one question on the president's booster and this display you have here. Is it partly a concern that after all the back and forth on the advice and guidance from the government, people are confused about the booster and maybe even more doubtful about it?
Well, I would say the reason we did this chart is because sometimes it's self-perpetuating. If everybody here is saying it's confusing, then people are going to think it's confusing. And so what I'm trying to do is alleviate the confusion, right? And explain these are exactly the categories. Anyone who's had a Pfizer shot 6 months ago, go get another shot. If you took Moderna or J&J, they're still considering that data. Don't get the shot yet, not approved yet. So we want to do everything we can to alleviate any confusion, answer questions people have. President went and got his shot, his booster shot on camera to make clear it's safe, it's effective, it's something you should do if you're in one of these categories. Go ahead.
Has Senator Manchin or Senator Sinema made clear to the president what their specific demands are for this reconciliation package?
I certainly understand your question, Caitlin, but I'm not going to speak on their behalf about what they, where they stand at this point in time.
Have they told the president, though, what their price tag is?
I will let them speak for what their points of view are. There have been ongoing discussions. We've been in close contact with them, as well as a range of members about the path forward.
Without saying what they are, you can't just say if they've actually told the president, here's where we want.
We'll let them speak for what conversations they've had privately. We're not going to provide more detail from here.
Okay, and what is your understanding on what happens to the CDC and the FDA's work on the pandemic if the government loses funding this week?
Well, let me first say that it is never a good thing for the government to shut down, and that is why we are doing everything we can to prevent that from happening. Because a great deal of public health, if not all of it, most of the public health work would be exempted from a government shutdown, but that doesn't change the fact that having services shut down, staffing cut in different agencies is not in the interests of addressing any crisis we face, including the pandemic.
So will they continue to work at 100% when it comes to the pandemic response, or what is the preparation for that?
Well, we, of course, as I noted and confirmed last week, we had begun making contingency plans, as every government does, as every Office of Management and Budget does, to plan. But again, public health officials, for the most part, would be exempt. But government shutdowns also are hugely costly. They would include the cutting of staff at a range of agencies. That's not a positive thing, obviously.